Welcome to Introduction to Catheter-Associated Urinary Tract Infection, or CAUTI, presentation by Northwell Health. In this module, we will review the risks and the impacts that CAUTIs can have on our patients, some indications for an indwelling urethral catheter. We'll review the proper technique of catheter insertion and the care of the patient with the urethral catheter. We will discuss catheter maintenance and use of the CAUTI bundle, along with nursing responsibilities and documentation. Urinary tract infections are the single most common hospital-acquired infection. Many of these cases are associated with the use of an indwelling urinary catheter. Proper insertion and duration evaluation can help reduce CAUTIs by more than half. On this slide, we will review a few indications for an indwelling catheter. Surgical patients may have an indwelling catheter inserted in the OR. This could be for continuous bladder irrigation or if the patient is receiving epidural anesthesia. Once the surgery is complete, the physician should consider removal of the indwelling catheter before transferring to the PACU. If the Foley is not removed, it should be reviewed again before the patient moves from the PACU to the floor. If the patient is going to experience a prolonged immobilization or if they're in a comatose state, you may also see an order for an indwelling urinary catheter. For our renal patients, we could use catheters for fluid challenges, or if the patient's creatinine is 1 milligram or more above the baseline admission level, the doctor may order an indwelling catheter. Before placing a catheter, we need to ensure that there is a physician's order in place. The order should indicate the need for the Foley. A daily order is then required for therapeutic long-term catheterizations. A licensed independent practitioner would need to document the rationale for any catheter that's going to be left in place for more than 48 hours. When inserting the catheter, proper sterile technique should be maintained. We also want to maintain a closed drainage system. If we do need to open up the catheter and tubing, we need to disinfect the junction with an alcohol swab before doing so. Once the Foley is inserted, we then need to document the catheter insertion date in our electronic medical record. At the end of this presentation, you will find a link for the BARD Advanced Foley Lubricath online education video. This slide lists the maintenance guidelines for patients with indwelling urinary catheters. Once the catheter is in, you want to make sure that the catheter is loosely secured near the insertion site with a stabilization device. The remainder of the tubing should be secured to the linens with a plastic clip, making sure that the patient is not lying on the tubing so that the patient does not have any skin breakdown or pressure ulcers. The drainage bag must remain below the level of the patient's bladder. When the patient has the catheter, there will be a urine collection container labeled with the patient's information at the bedside. This is used to empty the bag and should be rinsed after each use. When emptying the bag, do not let the spigot touch the collection container to prevent cross-contamination. Sterile techniques should be used when inserting a catheter and whenever you're obtaining specimens. If your patient is going to be transferred to a higher level of care or an ICU, the collection bag should be changed to a urometer. Before transporting the patient, please empty the urometer and the collection bag. Once a shift, perineal care should be provided. Do not use chlorhexidine, but instead warm soap and water. At the bottom of the slide, you will see a picture of the stat lock securement device. This should be attached to the patient's thigh to secure the catheter. Perineal care is not only to ensure patient comfort, but it also aids in preventing infection, skin breakdown, and odors. Perineal care should be done once a shift and as needed with soap and warm water and rinsed well. You may also see on your unit designated cleaning products that are used after the patient has a bowel movement. You should not be using any powders for the perineal area or any adult briefs. In the next series of slides, we are going to review nursing documentation in Sunrise Clinical Manager. On this screen, you will see that we have clicked on flow sheets, and under the I&O flow sheet, you want to right-click and select Add a Parameter as indicated by the arrow and red circle. Once you've clicked Add a Parameter, a pop-up will appear as shown on the screen here. Here you want to select Indwelling Catheter Urethral. Once that is selected, you will need to right-click on the field to modify row label. Here's where you can include the type of catheter, the size, the amount of water used to inflate the balloon, the date of insertion, and the urine output. You can also click on Assessment and Intervention Flowsheet, and then click Genitourinary Intervention to document the information requested in a single time column. Any patient and family education should be documented in the Adult Education Outcome Record in the Teaching Learning Assessment section. In summary, prevention is key. It is up to us to ensure we are maintaining proper sterile technique and performing proper hand hygiene immediately before and after any manipulation of the catheter site or apparatus. We need to maintain a closed drainage system, so we should not be breaking the seal between the catheter and the drainage bag. The bottom half of the screen reviews the items that a licensed independent practitioner will need to assess on the daily basis if the catheter is to be used for longer than 48 hours. This includes a daily order with the indications for the continued use, daily assessments, and documentation of consideration of alternatives for patient care. On this slide, you will see two QR codes. The code on the left will bring you to the BARD Advanced Foley Lubricath education video. The code on the right will bring you to the BARD StatLock video. To access these videos, please pause here, take your phone, and scan the code. If you are an Apple user, you just need to open up your camera app. If you are an Android user, you will need to download a QR code reader.